project worked with groups across Wales to create a national people's experience survey suitable for the use in any healthcare setting. As a people's experience project, the service user input was essential in developing a survey that was meaningful to people across Wales to support service improvement in the NHS. The final validated people's experience survey will be used across NHS in Wales to collect real-time experience data to drive service change and deliver equitable and quality services to our communities.
As someone living with a rare chronic condition, it has been incredibly rewarding to work with different groups, be heard, and collaborate on the development of this important survey, which aims to gather feedback from people in Wales, improve our health service, and make a difference.